Good afternoon, everyone. Good morning, everyone, because we have a wider audience from different countries. Welcome back to another episode of Dhammapariyesanā. Today's episode 38. And we had an interview, another episode today, early morning. That was episode 37. It was about physiotherapy and how it is impactful beyond pain management. So today, I invited a special guest to talk about something really different. So it's a great pleasure for me to introduce our guest today, who's going to talk to us about how we can cope with grief and loss. She's none other than Aruni Marapane. Aruni Marapane, I want to actually paraphrase her biography, short bio. Aruni Marapane earned her MSc, Masters in Gerontological Studies. Now, a lot of people don't know what sometimes is a gerontology is. Gerontology is the study of, I think, aging. We all age positively, negatively. So, so Masters in Gerontological Studies from Miami University in Ohio, US. As a Buddhist chaplain of VITAS Hospice and UC Health, Westchester Hospital, Aruni provides spiritual and pastoral care to patients in long-term care facilities, hospice and hospital settings. She also specializes in providing therapeutic massage for the elderly and dying, healing touch practice, as well as grief support facilitating. Her mission is to ensure that no one dies without the love of those around them. In this capacity, she travels to communities to teach and raise awareness of the sacredness of hospice care. And Aruni is a local of Cincinnati, Ohio, United States. Dhamma folks, please join me in welcoming Aruni Marapane to our program. Aruni, how are you doing?
I'm doing good, Bhante. Thank you for having me today.
You have a pretty amazing bio. As Sri Lankans, we sometimes focus on things that we could do to communities, especially from a spiritual point. But you have gone to an extent that how the West has incorporated helping the elderly, especially those who are, probably going through different grief, losses, based on hospice settings and hospital settings. So, on the other hand, the words called grief and loss. Now, in Buddhism, we know grief is the fundamental outcome of samsara. Now, if you go back to Dhammacakkappavattana Sutta, we know Buddha says, Sankittena panchupadana kanda dukkha. So, in short, clinging to 5 aggregates is, I would say, suffering, but true suffering, people are going through grief. Even we go to Satipatthana Suttas, both Satipatthana Suttas in the Digha Nikaya and Majjhima Nikaya, we can see that Buddha says the ekayano maggo, the direct path to Nibbana is the mindfulness. In that mindfulness definition, we find out a kind of a phrase, dukkha domanassanang attangamaya. So domanassa, so suffering and grief. Now this is a translation. Domanassa. So domanassa is what we understand by grief. And loss is very manifest, because we know loss is that we lose something, someone. So today we're going to be discussing about how to cope with grief and loss. I know that we will miss people, things, but at a certain point, we need some coping mechanism to be with us at the same time to move on our life. People might, go away from us. Even we will go away from our other people who really like us, who really dearly to us. But we are trying to aiming at how to cope with grief and loss from the perspective of gerontology and your own experiences today. So, thank you for accepting the invitation, Aruni.
Thank you, Bhante. Thank you.
Okay. Okay, let's begin our discussion. The first thing I wanted to ask you is about grief. What is grief? Now, there is no right or wrong way to grieve, but regardless of nationalities, countries, cultures, we all grieve. The fundamental reason that we see from Buddhism is, as I said to you earlier, about clinging to five aggregates, even though we know this spiritually, but in the real life, it's a challenging thing for all of us. So, and also we know grief is a natural response to loss, and it is basically the emotional suffering. So we may experience all kinds of emotions because of grief. It could be um, you know shock, anger, to disbelief, guilt, profound sadness. Now in the profound Buddhist teachings, we know grief is a response to not accepting what happened, because we are kind of like having dosa, anger. We don't like what happened. We think that it shouldn't have happened. He shouldn't have died. She shouldn't have died. This shouldn't have happened. So we kind of like looking at um, in a way that we don't like it. We have a utter denial about what happened. So at the same time, this particular grief can come from different channels. It could be a divorce or relationship breakup, loss of health, losing a job, loss of financial stability, like what a lot of people are going through this time, a miscarriage to a couple, retirement, death of even a pet, loss of a cherished dream, a loved one's serious illness, loss of a friend, loss of safety after trauma, even selling sentimental things, selling one's generational house as well. And it could be even small too. Sometimes people don't like to move to a new place because they have nostalgia and all that. So it's a big concept. So my first question to you, Arun, is what is grief to you in your personal understanding as well as through your gerontological studies understanding?
Mm-hmm. Okay, you pretty much explain. You pretty much explained that, Bhante. As you said, grief is a natural emotional reaction to a profound loss, and so that loss could be very much individual or universal. And this the most important thing is this natural emotional reaction. The intensity of the natural emotional reaction is going to be depending on the situation and the circumstances, and it's going to be very individualistic. So how much somebody has given value or significance to the what that person lost, depending on that value, how much you're going to grieve. So the grief could be that emotional reaction is going to be very different when it's come to an elderly person, to a child, to a young person. And as you said, it's going to be very different culturally, geographically, and all kinds of condition ways. It's going to be different. So pretty much the basic perspective is, outlook is, it's a very natural emotional reaction to a very profound loss in our lives.
Okay, so well, I mean, looking at different types of grief, do you think that we as human beings, we know that even animals, they mourn over their deaths, especially if you take a look at our monkeys. I mean, if a fellow monkey dies and they all get together, flock together, and they mourn. I have seen BBC videos, documentaries. So looks like that grief is not even common to human beings, and it is also common to some animals. I don't know, pretty much all animals or many animals, or kind of partial, level of animals. So, in your thought, what is the basic reason why people grieve? I mean, we know that there are reasons. I mean, what is the fundamental philosophical or psychological point of view why people start grieving about things right away? Because it's kind of a natural reaction, I guess.
Yes, Bhante, thanks. It is as I said, it's the importance and significance you have given to that object or the relationship or your loved ones to the loss, and how important it is, how positively it was affecting our lives. Now all of a sudden it has changed. We are missing it, and now you are at a loss because you were so attached to it, and more than the attachment, you were depending on the that object or the relationship or the person, and that object or the person or the relationship had a lot of profound effect on your life positively, and all of a sudden there's an empty space, and then you don't know what to do, and that is actually because of our clinging and attachment to that person or the relationship or the object.
What if we put our emotions on an objective way rather than subjective way? Because we don't grieve when someone who we don't know dies, mostly, but we grieve a lot when someone we know go away from us. So looks like that we take everything subjectively. I mean, this is going to be Vipassana, actually, so we don't see things as they are, so we see things as we are. So yeah, it's pretty much clear. So let's talk a little bit about some of the myths and facts about grief and grieving. When we talk about grief, suffering, mental pain, all that, there are a lot of myths. So we have to find out some myth busters. I'm just looking at what are the kinds of mainstream myths. Now, one myth is that the pain will go away faster if you ignore it. This is one of the myths that, do you have any view about it? Any thoughts about it?
Yes. And I hear this all the time in many cultures that I hear, and I personally myself had gone throughout my life from my loved ones and my support, my social network around me, saying that just focus somewhere else. Don't pay attention to that issue or what you have lost. Quickly moved on, and so that grief will, your pain will go away. Basically, it's kind of an encouragement not to think about it. But as a group support facilitator, I know this is a very big myth, because we really have to constructively and appropriately take time. That is the thing, constructively and appropriately. We have to take our time, and we must take space for ourselves to contemplate on what we have lost. It is very, very important. In that way, we are analyzing. We have our time to analyze our emotions, and if there's, for example, there's guilt, we can, look around it, touch around it, and see why, what. We have time to put things together. So if you don't look into these issues, what you're doing, you're putting inside, it's compartmentalizing. You're putting it somewhere else and postponing. And someday, one day, it's going to come out. And then you are not ready most of the times.
So ignoring feelings, pain is not a good idea. So you have to accept your feeling. That is, I think we had a discussion about it, like a informal discussion about why people hide their feeling, especially when it comes to tragic situations. So yeah, that's a good myth buster. And also, some people say that they are kind of like giving some timelines for grieving. So grieving should last about an year or something. But I think it is also one of the things that we already discussed. We can't give a specific timeline of grief, because the more you hide it, the longer it will be with you, because you have to accept the emotions regarding grief and then to work with it. What about moving on with your life means forgetting about your loss? So now this is on top of ignorance, forgetting about the loss. Is it possible to forget a loss or a grief easily?
I personally think that you will never forget. I don't think, because it's part of our memory. It's part of who you are, part of who I am. We can never forget. But our emotional attachment, the time we spend with those thoughts, with this attachment's going to dissolve as time goes by. but you'll never forget. But your attachment and your involvement with that grieving situation is going to get lesser and lesser.
Okay, once again, it means accepting our true feelings, and then working towards how to understand what's going on, how to understand our perceptions about things. Pretty much it's about looking at the source of suffering, grief, and all that. Once again, we are taking back to the Buddhist teachings. Okay, let's delineate a little bit about some of the stages of grieving. Now, I know in 1969, psychiatrist Elizabeth Rose introduced what he called by 5 stages of grief. Now, this is kind of a perfect case study about grief and how grief comes into existence. So, example, denial is the first stage, and second stage is anger. Third stage is bargaining. The fourth stage is depression, and fifth stage is acceptance. So, how do you view these stages of grief, Aruni? So, how do you view these 5, and what's the importance of these 5 to someone who wants to get out of grief, cope with grief?
Yes, this is understanding about these stages are extremely important when we, as a grief support groups facilitator, or if for oneself when you're going through grief, or if somebody who close to you going through grief, it is very, very important that we understand. What I like about these natural stages are that it gives us hope. When we are educated about these stages, Bhante, it gives us hope. It will take its own time, depending on the individual and the situation. But we know at the end of the tunnel, there's hope. So let's say first stage is shock and denial. I mean, anybody who will get this, all of a sudden, this surprising news are in a shock. And it could be a very grave one or a short one. And at that time, it's physically affecting. It's the physical symptoms are predominant. And the next stage is guilt and pain and hurt at the longest and the hardest stage. And at that time, the emotional symptoms are present. And then the next stage is, as you said, anger and bargaining. At that stage, you could clearly see the spiritual distress is there. Because at that stage, somebody's asking why and how and what's the meaning of life. These are very spiritually inclined questions. And then the depression, loneliness, then comes medical intervention, if that is uncontrollable. So then the upward turn started slowly, accepting and hope. So to have the interventions, to seek help, so understanding these stages are very, very important to all of us at all times.
At the same time, do you think that everyone who is grieving go through these 5, probably a couple of them, right? So it's not always everything, but basically there is a denial, apparent denial, and then it is actually followed by anger. Why is acceptance so challenging to many? I mean, that is the goal, I think, of these stages. I think, at the end, if you can remember what happened to Kisa Gautami. Kisa Gautami brought her dead baby to the Buddha, and Buddha, they didn't say, everything is suffering, anicca dukkha. Buddha didn't say that. Buddha wants her to understand with an empirical example. He said, I can cure this. I can get his life back, but on one condition. That is, can you bring me some mustard from a house where nobody has died? And she went from one house to the other house, and people said, okay, we have mustard, but the problem is somebody died. So, at the end, she comes to the point that this is acceptance, rather than telling kind of a big Dhamma talk that, everything is changing, so that unsatisfactory, and then we can say, I mean myself. So I think we all need some practical lessons in the way how we behaved, our own circle. So I think acceptance this gerontological temple, acceptance is such a very important thing, stage of life, not even for grief, but also everything in our life.
Mm-hmm.
So, what do you think? Why is it so challenging, Penny? Why people can come to acceptance right after denial? Why they take another few steps to come to this stage?
This is my the way I look at it, Bhante, through my Vipassana meditation practice for a long time, as well as my professional and personal life. This is an energetic transformation. You know that everything, thought is an energetic construct, and it is a transformation, and the transformation takes time. We are in time and space. It takes time, and we, as for our conveniences, we have name these stages this. But when you really look at it, it's like a flowing river. River would just not jump and flow to another bend. It has to just slowly take its own time, take its own bends and difficulties and obstructions, and go to wherever it is. So grieving is just like anything else. I think it's a beautiful way of life lesson, I think, right? So when we imagine somebody's at the acceptance level and you look back and you see, oh, I was in shock. I remember how I reacted, and it could be different to each other. I mean, to different people, different. But somehow I was not depressed. I was able to get out. Or I was depressed. Or make sure that next time a loss happens, because losses are going to happen no matter what, all the time. Loss and gain is part of our existential realities. And this is a learning experience life is giving us every moment. These are the way, could be all the steps, could be too few steps, could be one. One can be shock and denial, and then he can jump into acceptance right away, depending on what you have lost and what the importance you have given to what you have lost. So, but we learn. The whole idea of being a human being for me is we are learning through our life, as you said, practically learning.
I like the point that you brought up, the meaning, the value we have given to all these. I think the suffering or the grief, grief forms. I mean, the level of grief is depending on how much value we put onto these things. Especially now, let's say losing a job. Now, this is the time that a lot of people are losing their jobs. Probably there are a lot of cuts to pay and all that, and some people, they are having different other losses, because losses and grief, they are all interconnected. So as Buddhists, you and myself, do you think that it is also important to look at the value we give to things that we like in our life? It's always prevention is better than cure, right? So rather than waiting until we lose something, do you not think that it is also better to check how much value, or kind of the value that we put on different people and things? Don't you think that we should have kind of virtues like upekha, not too much into something, or not too less into something? Like, if you take an example of people who are into so much liking about other people things, and sometimes they are too less liking other things, other people. So don't you think that a balanced understanding, a balance in our life will give the proper meaning to things, so that even things loose, go away from us, people, we will not that much struggle? So what are your thoughts about it?
Yes, Bhante, that's a wonderful question. This is where Buddha's teachings comes directly, right? And this is the really understanding about three characteristics of life, all phenomena, impermanence, essencelessness, the anatta, and dukkha. All three characteristics comes to be, because if we know This is gain and loss, and all these are innate to our lives. These are existential realities. What arises has the nature to pass away. It is the universal truth. What arises has the nature to pass away. So everything, us, our bodies and our thoughts and our perceptions and our materialistic things and everything has a time, and it'll pass away. So once we know, and as you said, with equanimously come to balance and understanding and accept for what it is, we can really enjoy life positively, because we are not attached and clinging. Yet we've been given all these beautiful things in life in every possible way. So we enjoy, but at the same time, we have strength and courage and wisdom to let it go when it's time to let it go. That's how I look at it.
But
And
people know they should let go, but they are not ready to let go, though. This is what can be seen in
that's
many.
the problem, yeah.
Yeah, they are not ready.
Uh-huh.
Okay.
That is why, Bhante, it's very important we adopt these healthy habits. That there are so many healthy habits. These are not even healthy habits to get out of a grief. These are healthy habits to day-to-day life for us to have a very productive and constructively intelligent, wise life. And then whenever the losses comes, it's not a surprise. We are ready. We are ready to handle it, and we grieve appropriately, and we cherish our memories, but we can let it go.
That's a good point. So we grieve appropriately, and we are ready to experience that in the way how we should supposed to be. We'll get into the Buddhist understanding with your experience at the end, but before that, I wanted to ask you about some of the symptoms that people are going through. Because a lot of people, they don't know that they are grieving. They are in grief. So if we take a look at some of the basic symptoms, I can break them down to emotional and physical symptoms. So if you take a look at emotional symptoms, we can see shock and disbelief. Aruni, you know that a lot of people don't know Buddhism, especially when they know Buddhism, they know some of the cultural, traditional things only. This is where, we are looking at people who are only, looking at what is loss and grief. But for us, if we know the, what you call the basics, fundamentals of Buddhism, this is not new to us. We know that these things happen definitely if we don't have this Tilakkana mentality. But for those who are viewing, and watching this thing, I want you to talk about, these symptoms so that they understand these are offshoots of, mismanaging losses and, grief over losses. So one of the emotional symptoms I could say is shock and disbelief. This is kind of like a fundamental, probably, early early stage of grief. Sadness, guilt. So guilt, I don't know if people have this mentality. What if, and should have, could have. What if, what if I did that thing? Could have, should have. So they are looking at these things and very resentful about what happened, and they have remorse about it. Anger, fear. So that is about emotional symptoms of grief. We take a look at our physical symptoms: fatigue, even it could be nausea, a lowered immunity, which is pretty bad in today's time because COVID is chasing after people who have a lowered immunity, weight loss or weight gain, pains, lack of sleep. So how do you see these symptoms, and then what are your thoughts? And because you also working with people who are going through grief, and you probably may have noticed, witnessed these things in them. So I'm looking at kind of an idea what you can share with us about these symptoms, both emotional and physical. At the same time, what is your piece of advice to those who wanted to get out of these symptoms in the first place? Because even to think about something Buddhist teachings, they have to fundamentally get rid of these things in the first place. So what are your thoughts about it?
Yes, Bhante, this is very, very important because you said emotional and physical, right? You said emotional and physical symptoms. Is that what you said? Yeah. So when especially I work a lot with palliative care patients and end of life care patients and elderly. And this is how we look at it. Or I've been trained, and this is how I help people, coach people. Um, these symptoms we categorized into not only physical and emotional, um, medical implications, spiritual, and socially. So, because when one person could be physically debilitating and really having fatigue and not sleeping and dehydrated, not eating well, but that person could be emotionally handling it well and spiritually handling it well, but socially it's distance. So when we look at these symptoms, it's important that we look at physical symptoms, as you said, that crying and headache and loss of appetite, difficulty of sleeping, weakness, aches and pains all over. And these physical symptoms are normally at the first stage of shock and disbelief, and very, very evident at that stage. But after that, it continues to, as you said, the emotional symptoms are very predominant: worry, sadness, anxiety, frustration, anger, guilt, depression, and PTSD. When you go through a trauma, it is very, very, very evident, and it's we really need to look into this PTSD, post-traumatic stress disorder, and the suicidal thoughts and actions. This is a very advanced stage of clinically depressed. These are emotional symptoms of grieving, and there are social symptoms: feeling detached from the others, isolation, cutting yourself from your loved ones, behaving in a very irrational way. And then comes the spiritual symptoms. Then the big questions: what happened, why that happened to me, why that happened to our loved ones, what's the meaning of life. These are the spiritual questions. And also these spiritual, this is where the suicidal thoughts and actions come normally, because these are the bigger questions we don't have answers. And then comes the medical implications. This is over, this being ignored a lot. People have no much of awareness of this medical implication, because of grieving, the blood pressure goes up, blood sugar goes up. There are hearing problems, there's vision problems. So when we know all these categories of symptoms categorized and differently, it is very helpful to bring the interventions. Otherwise, all the symptoms are all over, and then we don't know what it is. What in this way we know when somebody is in spiritual distress, what to bring. When somebody is in emotional distress and depressed, to take that person to a psychiatrist or the psychologist. There's medical implications. There comes the medical interventions, physical. So we might take them out for a walk, or their diet or dietitian. So it's very important we look at this way. This is how I've been helping and taking care of patients.
Great. Looks like it's a very complicated, situation when someone is in grief. That is why Buddha added this to Satipatthana, Dukkha Domanassa. So Domanassa, it's basically the mental pain, because it is actually what you call more severe than physical pain. Now, in one sutta, Buddha says someone can say, "I'm healthy for a week. I'm healthy for 2 weeks, 1 month, 1 year, 2 years, 7 years, probably 10, 20, 30, 40. But the Buddha says nobody is healthy if they don't have mental health. They are none other than arahants. So arahants are the perfect healthy people, because what are the mental illnesses? I mean, in terms of even anger, jealousy, they all are, mental pains. Okay, now we come to a point to talk about some of the ways and means how one can, uh, overcome or cope with grief. So Aruni, can you delineate a little bit about some of the key aspects or some of the key tips for someone who is grieving about a loss, whatever the loss? Uh, you know, what can someone who is grieving practice as tips to get out of grief? I mean, we can talk about from a gerontological perspective, and then we can talk about the Buddhist perspective after that.
Yeah. Okay, let's get an example, Bhante. Like, for example, if somebody is in, let's say, in a retirement community or assisted living, there's an elderly couple who's in, let's say, 80s or 90s, and one spouse passed away. So their marriage is like about, they've been married for 60 some years. They know each other forever. And then if you ask me, like, how do I help the surviving spouse? As I said earlier, these categorizations, spiritual, mental, emotional, social, it is very important to identify where these persons are in these symptoms are concerned. The very first thing I would look into is their social network. Do they have a very kind, loving, empathetical, actively listening social network around them? Just being in that network of, being with that loving people, you are getting healed. We know as human beings that there are people are listening to this person. There are people who are coming and sitting with this person, giving enough space to this person, non-judgmental. First thing I would look into that this person is surrounded by a very good, healthy social network. And I would encourage a patient to always be with a very good social network. And then unfortunately, I see that a lot of times people are lacking this aspect, that they don't have people around them who would willing to take time and willing to sit down and listen to them. All their lives they had friends and people. When the loss happens, a catastrophe happens, a trauma happens, you're alone. And I just still cannot understand about our world. Different cultures are different, of course, in some cultures, and then the whole village comes and sit down for months with this grieving person. Some cultures, you are being left alone. So this point needs to be addressed. And also eating habits, drinking water enough, proper medical care. This person is allowed to express emotions without holding them. What are the cultural myths and stereotypes and inhibitions? And does this people have a person has enough spiritual health? It is very, very, very significant, and it's overlooked. Spiritual health is so much overlooked when it's come to trauma and loss. People are so much concerned about why you're not eating, why you're not this, why not that. But then spiritual strength is very important. So we need to inquire, or we need to encourage that person. Would you like to have whatever the belief system they are? Would you like us to provide that? Or I encourage the loving network to provide the spiritual health and enough sleep. And that is one of the hardest things when you're going through a trauma or a loss or grieving, that people having less sleep, and it becomes a vicious cycle. So if you cannot sleep, we must encourage them to see a doctor, get medical help, get a sleep aid, and get enough sleep. And then as you moved on, having good healthy habits, reading, listening to music, walking, journaling, that comes later in a grieving period, but these are also very important. And if you're doing already these activities, encourage them to continue to do it. And change of environment, this is overlooked, that you're stuck in a room, stuck in a home with familiar surrounding, which reminds you of the loss. So take them away from there gently, and distract them temporarily, so that they will have some time of like a relaxation. So there are so many things, Bhante, we can do. Exercise, I forgot to mention that, outdoor activities. But all these things comes in the different stages of grieving. But the very first stages, we need people around us. It's very, very important.
So, a couple of the steps that you mentioned, they look pretty amazing. Good friends. Now, actually, people always overlook about good friends. They might think that friends who come over to their parties and all that, who always say yes to everything, they are the people. But when catastrophe happens, and you might not have them anymore. So that means that reminds us the first Mangala Karana, the Mangala factor in the Mangala Sutta. Asevanacha Balana. We had to, in our life, we had to make the first decision to be with the wise individuals. They won't leave us, especially when we are in pain, when we are, in front of a tragedy. So good friends, especially good means wise friends, not good friends, because people can take good in a relative way. They are good to us, right? And I think a lot of people neglect spirituality. They ignore it. I would say they sort of underestimate, because spirituality and religion, they are both taken in a similar way. This is what I can say in many. But spirituality is mostly, considered with minimum, I would say very less religious elements in today's world, because a lot of people say I'm not religious but spiritual. So there is this trend coming up in many. So we should not disregard the value of spirituality. So this may not have religious elements, but we all have this spirituality. So that is another help. As you said, sleep. Sleep is one of the very important things, because if you don't have a sleep, you may be moody, angry, I would say snappy.
Tired.
Yeah, that's really a bad thing if you don't have a proper sleep consistently every day and outdoor activities. Okay, this looks to me that the person who is in grief have to look at external kind of things. What about internalizing grief? Now, I know the Insight Meditation Society in the US, they have this very famous acronym, RAIN, RAIN. I mean, if someone is struggling, suffering with any pain, I mean, this is actually a completely Buddhist idea. One has to first recognize that particular activity, pain or suffering. I have this pain or suffering, in this case, grief. A stands for acceptance, the hardest thing that we talk about in the what you call stages of grief, the last one, the goal. Accepting the particular recognizing part, grief. And then RA, I means identification. That means, investigation. So we have to investigate our grief in multiple aspects. Could be physically, emotionally, mentally. Now, for example, if I'm in grief, I can feel that I am having heavy breaths, I'm trembling, and I'm very moody. So I can notice my physical. A lot of people don't do that. That is physically. And mentally, a lot of people can understand why people are very grumpy and there's something going on with them, especially people who are in grief, so on and so forth. And the last part of this RAIN methodology acronym is N. Now, this is anatta, non-identified. Let's say we are in grief, and then if we can deconstruct the particular event, the particular person from us, and there is this relief, because the more we personalize, construct us with the events, people, the more we suffer. So it looks like there is an internalizing process about how we can get rid of grief in this case too. So now we're talking about how to externalize kind of way out about grief. So what do you think about this external and internal steps to get rid of grief? Now, I know that you are kind of a meditation practitioner. So, and I probably think that you may have gone to some Vipassana countries too, right? Burma? You haven't been yet, right?
No, but
you look forward to going.
My teachers are from there, yeah.
And you have your own Vipassana meditation practice. So how do you see this from an inward kind of perspective? How can someone, that is the that is the fundamental Buddhist perspective. I know Buddha also talks about you should have good friends, you should not neglect your spirituality. Buddha also talk about sleep, and he also said you need to socialize to an extent where you can find relief. But what about internal ways to overcome or cope with grief over a loss?
Yeah, there simply, Bhante, there comes our meditation, insight meditation. When I'm sitting with a cancer patient and being given the news that that patient is terminal now and in intense pain, and one way physically that patient has to handle unfathomable, indescribable pain, and then emotionally now you are leaving what you've been loved, and this is a loss. This is anticipatory loss, and then that person already has started grieving. What I'm guiding through them, how slowly from personal to impersonal, and individual to universal, and showing it's not you're undermining, not at all, but very gently showing them these are universal existential realities. And you take, like, for example, pain, we own it. That's why we other than the physical pain, we hold on to the pain and we indulge the pain. That's why pain is 1,000 times more. So once I sit with them and go through slowly, mindfully, lots of patients being able to, it's not with the word detachment, untangle from that. And it kind of looking from like a witness, watching your own body, that pain is, you don't own it, and let it be. And it's not easy, but then you watch it rising and passing away, rising and passing away. And the impermanent, it's an impermanent process. And you can't do it in 1 day or 1 minute. And I'm with a hospice patient 6 months or 3 months. I've continued to visit, and I've been able to very successfully guide them and detaching from these traumatic events. And also, if let's say a loved one is gone, a husband's gone, and the wife is grieving, let's say an elderly couple, slowly going inside that person, inside the mind, and I was able to show this person, it's not about the one who's dead that you are crying. That's about your own, it's about you. We had to do it very gently because people can misunderstand that it's just like kind of feeling that it's kind of rude. But then there's a way to do it. And finally, we are not crying for the person who's gone. We are actually crying because we don't get the pleasure we thought we were getting out of them. At the end, it's our own thoughts we are struggling.
Is it more likely a selfish way of looking at it too, indirectly? Yeah,
exactly. We know inside that is innate and it's normal, and it's we all have to go through. It's the pleasure we got out of that association we are not getting physically anymore, and we are attached to that pleasure. What's a pleasure? It's a thought, it's an idea, it's a sensation, and we are attached to that memory of that, and we cannot let go of that memory of that pleasure. So it's at the end, it's all about us, how we think. And we had to do it very gently, very respectfully, kindly, because otherwise just like as if like you're taking, ripping off something from them. It takes time, but it's very successful when I'm teaching meditation and guiding them.
Yeah, so that's why upekkha is the highest virtue, as I said at the beginning, because even when someone practices jhanas, first, second, third, fourth jhanas, in the first, second jhanas, the yogi still, has piti, rapture or joy, but at the fourth jhana, he or she is coming into a point, enjoying upekkha, equanimity, because in our day-to-day life, either we attach or detach. This is what happens to us. Either we like so much, either we dislike so much. People don't think there is a middle way. There is a middle place where we should stand. That is where we talk about the meaning we apply to different objects, people, and then the aftermath. When we mismanage the meaning, the given meaning, definitely we are with grief, and that's what we talk. Aruni, one last thing I want to ask you. Now, we all are at different levels of our life, different stages of our life. Some people's parents are dying. Some people's, especially at the moment in some countries, people are dying, continuously in some places. So we know that time plays a bigger role. Time plays a bigger role. We can't say I might be better in next year or a couple of years after. So why is moving on with life very important? No matter what kind of pain, no matter what kind of grief you're having over any loss, why uh, even a thinking of, even a positive feeling of moving on with life is great. Why do we need to ask, suggest, recommend people who are already going through grief need to think about, hey, your life has not ended. You have a long journey to go, in the future. So why is it important to move on with life, especially when it comes to grief?
Mm-hmm. First, as we all talk about it now, we are going to accept these are existential realities: loss and gain, fame and anonymity, humiliation and fame, happiness and sorrow. These are existential realities. This is normal and common to universally to all sentient beings. So we know the answer is in front of us. Let's say someone passed away. The fact that somebody passed away is showing us how impermanent life is, how short and vulnerable life is, how important it is not to stuck and move away, move on. The other thing is, whether we like it or not, life is moving on. Life is going to move on. Life is going to give us every single living moment new experiences. If we are willing and we are open and we are ready, it always gives us. So it is important that we understand how vulnerable and short our lives are to take the best out of the situation. Even if, say, let's say somebody is very dear to us is gone, what would that person say? That person would not expect you to us to grieve forever. That person would say, yes, I had a life and we lived and there were different circumstances, but it's time to move on. But there's a balance. We are human. We are allowed to be sad. We are allowed to be emotional. We are allowed to be grieving. It's okay. It's perfectly okay. That's what is to be a human being. It's beautiful. It's a tool. Yeah, because when you look back, the best we have learned through that time period at the end. Once you come out, almost everybody I have helped or gone through with this process, even myself, I look back, I lost my parents, my mom like 8 years ago. That is the one of the best times I have learned so much. But once you're going through, it's not easy. But after that, you look back, I can see that how strong I was. Um, I was able to go back quickly and be with her and alone. I went there and crying in the airplane. And so you become stronger. You learn.
That is the perfect lesson. When our people die, we should take it as the best lessons, those people give us. I will thank you. And are there any other things that we have missed out on today you want to add before we conclude?
Um, I think one something little I want to tell. We must never, I'm sure, Bhante, you're going to agree with me, we must never wait until we lose something to find interventions and techniques and adopt healthy habits. At all times, if we can find a way to be mentally and emotionally and physically and spiritually, try our best to be healthy. We never know when the losses are going to happen. Catastrophes and traumas going to happen. It can happen anytime. That's what life is about. And we are ready. We are equipped. We are ready to handle it. we are in this balanced state. So that's what I want to tell you. And at the end, I do have these. I mean, a lot of them know about this prayer, Bhante. If you don't mind, I will say these few things. So be a channel of peace to yourself and others all the time. Be a hope to yourself and others when there's despair. Be a light to yourself and others when darkness is around. Be the joy of life when there's sadness around. Remember, by giving only you receive. When you follow this path with light and love, when your turn comes, there will be tremendous light and love to comfort you, and your journey will not be that difficult.
That's a very wonderful note. Thank you.
Thank you, Bhante.
Dhamma folks, today we've been talking a topic called coping with grief and loss, and joining with me today was Aruni Marapane, who is a special person when it comes to talking this topic, because she has earned a master's degree in Gerontological Studies, especially the science of aging. And we started our discussion in looking at what is grief, and then we were talking about reasons of grief, and then we also talked about some of the myths and facts, of kind of like myth busters about the generic grief. And then we also talked about the stages of grief. Actually, initially they were introduced by the famous psychiatrist Elizabeth Ross in 1969, but we discussed those 5 stages in relation to present-day life. And then we discuss about symptoms of grief, both emotional and physical. And finally, we discuss about what are the healthy habits to follow if you are recently going through grief, or if you will be going through grief sometime in the future. And then finally, we talked about why we need to move on with our life, because we always think reality is under us, but actually we are under reality. That is where we ended up, especially this discussion. Thank you, Aruni, for joining with us, and thank you our viewers for joining with us for the whole time. And I hope that you learn a lot of things. And I also want to ask Arun to mention about Vihara. Vihara is one of our friends in our temple, and she's the one, I think. You want to say anything about Vihara?
Yeah, I thank you so much, Vihara. Vihara is the one connect me with Bhante. She gave me the opportunity to talk to Bhante, and here I am. So thank you so much. Yeah. I'm very grateful.
So just to give a sense of appreciation to all who are enjoying, and your husband, he was really helping you to setting up everything, and your friends, everybody's watching all this from many places. Thank you, everyone, and I hope that you have a good day, have a good night for those watching from Asia, and then early morning, and stay tuned with us for another episode. Thank you. Have a good day.
Thank you.
Thank you.